Fiona asks, would you recommend dental cleanings and how to prevent tartar? If I detox it from anesthesia, what do you recommend? Well, yeah, I mean, it kind of depends. Dental cleaning, if it's necessary. It's kind of become a big thing for every veterinary practice to push the dental cleanings, maybe a little too judiciously. But, you know, if they're accumulating tartar and they're a healthy animal, we might want to, again, relook at the diet. That's kind of the first place I start. Um, but Jeff, you have anything to say on that? We can talk about anesthesia next.
Yeah, just that the dental issues are almost always preventable with, raw bones, edible bones. And even if the tartar is already built up, chicken necks and turkey necks work real well, but you may have to hold them right where the tartar is building up. And there's a product from New Zealand, regenerative product with oral spray that actually can help as well. And that is New Zealand deer velvet products.
Yeah, Dr. Judy Morgan has a product too. We'll plug her products too. There's a number of products out there. There's one by Animal Essentials, and it's a version of Plaque Off, but theirs is quite a bit cheaper, and it's it's a kelp-based product. Have you used those, Jeff? They can work.
I used to use Plaque Off until I discovered the Raw Paws version of a kelp, which is the exact same species. So you get it for about a fifth or less of the price.
Yeah.
A big bag for the same price as that little jar.
Oh gosh. And then and Animal Essentials again, who's one of our speakers. I like their product, but it's an interesting story about that. That I understand that originally the Japanese scientists figured this out, and some of the observant scientists noticed that there were no barnacles on the boats that were moored in a certain area with kelp of a certain kind. Yeah. And then they said, oh, that's interesting. Why do those boats not have any barnacles? And so then they started experimenting, and then it became actually human products. And then from there, they, used it. And you can just put that in the food. It's easy to put, most dogs tolerate it. It smells very fishy. So some dogs may not, or cats may not go for it. But it can be quite effective at removing, softening, all of that. So when you think about it, barnacles have a lot of calcium because that's how they adhere to the boat, which is very much what's happening, in the dentition. So that's one of the first things. And I agree with you. The healthy bones that they can sink their teeth into is the easiest. I've seen many dogs where I've told for a week, I said, you got to give these bones this size, whatever, depending on the size of the animal. A week later, the tartar is gone. So there's a lot of different things you can do besides there's also non-anesthesia dentistry if your community has it, and if your animal is a candidate for it. It's a great way to remove bulk tartar and also polish, but it's not like extensive. They don't do x-rays, they can't do any extractions. So depends on, your animal, and, but it's a great way, especially if you need to do it often. But again, that's a sign of chronic disease. So hopefully doing some deeper internal treatments, will help slow that down or stop it. Anyway, anesthesia. Okay, let's just talk about that real quick. I have a whole protocol, but basically I use homeopathic phosphorus after anesthesia. Do you, Jeff?
Sometimes, but I will frequently use detox in the form of a fiber. I was on a human detox seminar. After going through all the supplements, it said none of them really work as well as fiber, which does what you mentioned about the lactobacillus as far as latching onto the toxins and letting it go out in the poop.
Does your dog have a chronic condition? Having a pet diagnosed with a chronic disease can be overwhelming. If you want to try a different remedy that is completely natural and safe, we highly recommend that you watch this next video.